Hi, my name is Jennifer Raichel. I'm an undergrad here at the university. I'm currently a junior studying environmental science. I'm a member of the SGA, and right now my position is chairwoman of the Undergraduate Experience Committee. I was heavily involved for plans surrounding events that happened on campus last year, such as the World Series event, and also dealing with the Blarney blowout and other associated events. From that, I was inspired to take on the issue of alcohol, and so far my committee and a lot of other senators have been working on that issue with us.
Okay, who am I? Hi, I'm Sally Linowski. I'm Assistant Dean of Students for Community Education, and my role currently involves working with off-campus student services to help our students live successfully in community and build community partnerships. I'm a double alum of the School of Public Health, Master of Science, and PhD, so really happy to be here on this panel. My work has involved implementing screening and brief intervention. I was part of the team that brought basics to the university and got some model exemplary program grants. Also have co-chaired our campus and community coalition to reduce high-risk drinking, which it sounds like we need to get Ken on board for, and working to help engage our students in helping to change this culture. So I have some initiatives that we're working on currently that I think are pretty state-of-the-art and working collaboratively with SGA, which we're pretty excited about some to launch.
Perfect. So I am Nicole Rao. I am a second-year MPH student here. My focus of study has been around alcohol and substance use, both in communities as well as on college campuses, and I have actually worked with Sally and the Off-Campus Student Center for 2 semesters now with a project called Walk This Way, looking at party crawl behavior and trying to offset some of the negative impacts of that behavior for our community members.
Hi, and I'm Gloria DiFulvio. I'm the undergraduate program director in public health, and prior to that, from 2004 to 2008, I was the senior evaluator for the Higher Education Center for Alcohol and Other Drug Abuse Prevention and Violence Prevention, and I work nationally to build capacity among college and campus professionals in the field, working to reduce substance use primarily. I also served as a co-PI on a grant with Dr. Linowski to reduce high-risk drinking using brief alcohol screening and intervention for college students. And that turned into a model program, as she talked about. And I also serve as a consultant for the Center for Applied Prevention Technologies that works to build the skill and knowledge and capacity of the prevention workforce in this area.
So we've got a good amount of expertise both outside and inside the university here on the panel. I'd love to start with questions from the audience first, or I can start one to get us going. Are there questions folks have? Yes.
I really enjoyed the science behind the issues today. But I'm really curious from Sally and Nicole, because I know that it's going to push to work with students off campus and make it a healthier environment, along with your safe walks. What you know nationally? What could be? What are some of your dreams to make things happen better off campus?
My dreams involve more students like Nicole and Jennifer working on these issues. No, seriously. I think when we get to the issue of off-campus conduct and behavior that causes community impact, what we're seeing more and more of is large-scale gatherings that are perpetuated and promoted by not only party promoters and social media. So that these events become, in the 1990s we had Spring Break MTV, and that's what we saw. Well, now we have recreations of those happening in every college community across the country, and they're promoted as sort of the local event. So I think what our greatest impact is on addressing those is engaging our students in how to, have the fun time and have a large-scale event where you have a lot of people to have fun, but how not to perpetuate the idea that everybody's doing crazy things and throwing things and causing violence and vandalism in our community. So I think the idea of engaging students at event-specific interventions, so there are specific events that we know are high risk, there are holidays that are high risk, there are traditions that are high risk. So campuses that have really had meaningful impact in this, like I think Ralph had mentioned, the Safer California Universities project. They took a targeted intervention approach at off-campus parties, with enforcement, with social media, and engaging the best practices around that. So I think if we can sort of hone in on some of those strategies, that will go a long way. I think we've made great strides as a university, and what we're facing right now is what every campus is facing in every community. And I think putting our heads together, we can come up with a good solution.
And I would just second having everyone be a part of the conversation. I think it's important to not only target certain individuals within a population to try to offset some of the impacts that we see through college drinking and the culture behind that, but keeping students engaged in conversations throughout the year as well as community members is what is going to help bridge that gap and create more of a cohesive, positive, healthy environment for everyone.
I was wondering if Dr. Hingson can comment on orientation programs for first-year students, anything that you know that's been effective in lowering rates of alcohol problems with that population?
Yeah, I think I have a mic on, it's not somehow. I think that, as I mentioned, the alcohol EDU is an effective program. I think it can be improved. I think the Safer California intervention was also quite good, and what they did was they made sure that the changes started at the very beginning of freshman year, so it would carry throughout the year. So they gave themselves a tight timeline to work with. There similarly has been a multi-component community intervention done in several universities in North Carolina. Mark Wilson published in the American Journal of Preventive Medicine. And what was interesting in using many of the same techniques that SALT's used, but what was interesting in that was they measured not only the harm that drinkers were causing themselves, but harms they were causing other students. And they found that they were able to reduce not only excessive drinkers harming themselves, but harming other fellow students as well. So there are some models out there that I think are effective, and we're learning more. We still have a lot of research in this area going on, and I would encourage people at this university, just as I encourage people at other universities, to apply to us for grant money and to study. If you're going to try new innovative approaches to address this problem, let's study it and let's see what works, and call out the ones that do work from the ones that are maybe not as effective. I think education alone has generally not been found to be particularly effective. However, if you combine education, let's say with law enforcement, as was done in the West Virginia example around drinking and driving, then it can be very effective. In fact, the sobriety checkpoints and so on, the programs that are most effective are the measure of effectiveness is not how many people get arrested, but rather the extent to which you can deter drinking and driving to begin with. That's really the measure of success. And the sobriety checkpoints, when highly publicized, can be very effective in lowering drinking and driving crashes.
And if I can highlight some of what we do in student affairs already. So for those of you that are students and went through undergrad here, some of you may have had to do the My Student Body module. So it's similar to alcohol EDU. So before students even arrive on our campus, they are asked to do an online educational module about alcohol. And they get a registration hold if they don't complete it for a second semester. So at least from the student affairs perspective, we start messaging to students about alcohol culture. Before students even arrive here, we also have extensive education with parents during new students orientation, as well as with the students themselves. So we've adopted a lot of these multi-component strategies that have been evident in the research. The Campus Community Coalition to Reduce High-Risk Drinking, which involves law enforcement. So we really are we're working on some of these evidence-based strategies.
I think it's very important that, and I think that's from what I'm hearing, it's happening here, that the colleges and universities work with the surrounding communities. For every 18 to 24-year-old who's in college, there are 2 that are not in college. A lot of times the problems with alcohol begin before college. So we know that those who started getting drunk at a younger age, when they go to college, are more likely to drive after drinking, be involved in automobile crashes after drinking, be injured in other ways after drinking, engage in risky sexual behavior, and so on. So it's a problem where the colleges certainly have a role, but they can't solve it by themselves. They really have to reach out and work with the community and work to address the problem with young people even before they become of college age. And then also with the people from the surrounding community that are college age but aren't necessarily in college.